Hello there, John Coturillo here, the life coach of your listener. Thank you for joining me for another episode. Today, it's my absolute pleasure and excitement to be introducing my guest to you, Ari Kulikov. Ari is a creative artist and a critical thinker with a lot of meaningful commentary to make on numerous different matters. I first discovered Ari relatively recently. I came across her artwork and her YouTube channel, and I was fascinated by all of it, but especially her social commentary intrigued me, and I was incredibly keen to take the time to learn from her. We agreed that it would be interesting for us to discuss the topic of gender theory, gender transitioning, gender fluidity, and the mental health aspects of this particular subject, as Ari has a lot of experience in this particular domain, and I was keen to learn from her experiences. So I'll hand over to Ari now. She can introduce herself, and then I hope you enjoy the episode.
Hello, my name is Ari Kulikov, otherwise known as Blunt Spork on YouTube and Spotify and everything else. I am a creator and musician from Melbourne, Victoria, and I am also a detransitioned woman. I was on testosterone from ages 18 and 19, a little bit into 20. I am turning 21 this year in November, and I'm going to talk to John today about some gender related stuff and other stuff, and I hope you guys learned something.
Hi, Ari. Thanks for joining us today. It's a pleasure to have you on. I've been really looking forward to having this discussion with you. How are you today?
I'm pretty good. It's my pleasure to be here because this is my first podcast, actually, ever. So yeah, I'm looking forward to it.
When I first approached you, what initially caught my attention was your very critically minded discussions of gender theory and issues surrounding it, such as gender dysphoria and mental health, and the relationship between the medical industry and how people work with their own gender identities. And I was really keen to learn from you because I understand that you have a variety of different perspectives on this. So you're an individual who has both transitioned and detransitioned, and you've examined a lot of different perspectives. So I believe that, as I'm always discussing with my audience, that multifaceted discussion is really important, and I was really fascinated by the different types of perspectives that you presented. I understand that one of the initial issues that we cope with in this particular subject matter is how to deal with hatred that's directed towards people with different gender identities, but also hatred towards people who have different perspectives on this matter. I think the key message that we want to convey to our audience here is that this video is not about pushing ideologies or particular belief systems or trying to reinforce dogma or trying to dog whistle to any one particular system of belief. This video is about exploring ideas, and our audience is free to take whatever ideas they wish to work with and work with them. But we'd also like to pay our respects to people who are at the moment experiencing issues related with their identity or their mental health, and we very much advise you, if you are experiencing any concerns at all, no matter how small or large they may be, please speak to a trusted healthcare professional. What are some of your perspectives on the topic of hatred and how we cope with it?
Well, I feel like a lot of hatred is rooted in misunderstanding. From my perspective, when I was transitioning, I did not encounter nearly as much hate as when I detransitioned. It was definitely still there, but I sort of coming out of it, I noticed more that when something goes against the grain, and a lot of people haven't really heard of it or don't understand it to a higher degree, is when people are more likely to just be hateful and just disregard people's personal experiences. But I think that it's something that needs to be addressed because it's hard to have conversations about important topics with so much like prejudice in the way. And yeah, I think that there's not really, it's not constructive, it's not very helpful to get to the root of important topics when you're met with hate, To saying that as well, there's been more support than hatred in general, and I think that's important. But yeah, it's definitely still a thing.
I'm glad that you've had more support than hatred, but I also appreciate that you're willing to take a risk in speaking about hatred and how we can best cope with it. So from your analysis, it sounds as though if misunderstanding is one of the primary substrata of why people become hateful towards one another, then perhaps the best antidote is understanding and compassion and understanding different people's perspectives and learning why they're held.
Yeah. I feel like in saying that, it's important to set aside your personal political alignments too. So I know we talked about how we should try to explore our ideas objectively without, political alignment being such an important factor. And I think that ties in with the hate aspect as well, because once you put things into boxes, you struggle to see the person who you're actually talking to. So I feel like in order for us to better manage the sort of like hateful and prejudice aspect, we should talk to people on an individual basis and try to get to understand their personal perspective, sort of taking away from all the boxes we could put them in, and yeah, really just trying to be compassionate. Even if you disagree with someone, like, you can still hear their story and have a discussion with them,
Absolutely, because
Yeah.
different people can be of humanity but still have different perspectives, and it's understanding those perspectives that is going to allow us to reduce hatred but also become more at one with each other.
Yeah. And also, like, listening to other people helps you check yourself sometimes as well, because you learn things from listening to people who have radically different perspectives to you. I feel like it's good to question your beliefs constantly, like question why you believe what you believe, and listening to other people's perspectives like is healthy. It helps you solidify your morals and stuff, and like it's everyone just lives in their perspective, so it's good to see other people's worlds and assess your own as well.
When you take a political alignment, then it very strongly biases the whole activity involved in the dialogue. So you're going to be essentially priming your mind to always approaching the conversation with a view to proving your own ideology to be correct and the other person's ideology to be incorrect. We can all be ignorant in some way, and there's no shame in that as long as we're willing to enter into dialogue, sometimes with the deliberate aim of not knowing exactly what's going to come with it, but to learn something nonetheless, because you're inevitably going to learn something even if you don't know what it is yet.
Exactly, yeah. When I was first recording my video, I kind of fell into the trap of being sucked into that sort of political, framing. Like, a few sections of my initial detransition video, when I was watching it back, I was like, oh, I think I could have worded it that a lot differently. The people who talk in this issue, I guess, a lot of them are very politically motivated, and it's hard to find someone just talking about the issue without tying it to like the left or the right. Like, I was referring more to the very out there activism on, I guess, people in the transgender ideology. So more not trans people who were pushing a sort of like false narrative, I guess, in some ways, because there are people now saying that it's boring to be straight, it's boring to be cisgender, and I was watching TikToks of people like showing me how to put binders on and stuff, and saying, like, that if you like express more masculine traits as a woman, then you most likely were trans. But that's not indicative of the entire like everyone who's trans. It's outliers that make their way into the media
discussing the evidence supporting and the evidence refuting different theories of gender and different
Yeah.
ideas about gender theory should be kept quite separate from the issue of how do you approach somebody who have a different gender identity, or how do you treat people, or how should society treat people who have different
Yeah.
gender identities, because the complexity is quite different. Gender's can be quite, and sex can be quite complex issues, and admittedly, the human race still doesn't understand them fully yet. The issue of how to treat people is, quite frankly, rather cut and dried, with respect, with compassion, and with the acknowledgement that people have their own journeys, have their own battles, and to approach something you don't understand or that you don't necessarily agree with hatred or anything other than the willingness to be tolerant and to talk to people is likely to cause great destruction amongst us.
Yeah. And it also it makes the opposition look bad as well. Like if your contention is that gender is like fake and everything, and you come towards people who identify as like non-binary, or with hate, it makes yourself look bad as well, because you're not explaining why you're being hateful towards them. You're just saying you don't exist. So someone who can only see their existence in the way they're existing. So for me, I can believe in biological sex, and I think that gender dysphoria is a real mental illness, and I know people with I had gender dysphoria. It's very real. People transition because they feel, they would be happier and more fulfilled, being perceived as the other sex. And non-binary people, I have sympathy for them as well. I'm not going to purposely anger or upset someone who's non-binary just because I might not, personally agree with the whole gender spectrum. I agree in femininity and masculinity being a spectrum within men and women, but I'm not going to invalidate someone's existence by telling them they don't exist. You know what I mean? Like, I feel like it's very important to just set aside your personal beliefs and actually understand why someone is feeling the way they feel.
But one of the key topics that we could establish before tackling some of the deeper ones is how understanding why some people might immediately come to the conclusion that when you disagree with their opinion, that it might be an invalidating experience, because both of us have some rather broad experiences, and
Yeah.
I know that me, with my lived experience of mental illness, if anyone were to make a suggestion along the lines of this particular condition or this particular phenomenon is not a mental illness, and then try to make justification of it, especially if it's someone who's never had that experience, it can be quite frustrating and confronting. It's sometimes hard to imagine that when someone says that, it's not done with any form of malice, but sometimes it may be, sometimes it may not be.
Well, I would yeah, I mean, I guess there are some people who genuinely don't understand at all, who would say that it doesn't exist, but there are some people who completely will deny for seemingly no reason as well, because there's evidence that mental illnesses like depression and anxiety have physiological effects on the whole body that are also visible to other people. So to deny that, I feel like, is very misinformed, very dismissive. For me, I understand how people can take disagreements as invalidation, because when I was transitioning, and I know a lot of people have a similar experience, but questions like that make you rethink your whole situation. Like, they make you reframe your entire perspective. So when someone disagrees with like something like gender ideology, or trans people even existing, to hear that as a trans person is like, what? But I exist, you know what I mean? It's like I'm sitting here talking to you, and that is how I fundamentally feel within myself. So to say that like it's not real or it doesn't exist, you're kind of like eliminating the person. So it's harder to hear disagreements about something that's an identity issue because it's hard to continue a conversation with someone who you feel like is not seeing you fundamentally as a person. So I definitely understand how if I disagree now with a lot of things I used to really believe in, how people who are still in the space that I was in would take that as like, an invalidation rather than a disagreement, because it's like it has to do with their entire being rather than just something, that's in the mind. It's like it affects everything and sort of domino effect into all parts of your life, basically. It's hard to separate like an ideology from yourself when you're sort of in that space.
The facts in that situation almost inevitably are going to be that it's not that that person is deliberately putting themselves in that space. That's their experience, and they're trying to find a way to make
Yeah.
sense of it, to cope with it, and to live their life as best they can.
Yeah.
And again, the objective reality of it is a completely separate issue, because you have to. We're still facing the subject of how to best help a person to overcome the challenges, because in the end, there is something unsatisfactory that they're trying to overcome, and it's sometimes even more important to consider how you can best help that person than it is the objective reality of the situation, because objective reality is important, but it's not going to do much good to talk about objective reality if that person isn't enjoying quality of life and can't find what they need.
Exactly. And I also feel like there's a certain point where you can get to psychologically where you can try to have discussions about what would be an objective reality. But when you're in that sort of space, when you're not really quite sure what your existence is yet, having those questions would be more detrimental than beneficial. And I do think in order to best help a person, like, you need to step into their world and see what they're feeling at the moment. And because, if you throw someone, too far out of their field of perception, it's not going to get through to them the same way it would if you were ready to really critically question your reality. I know I definitely was not in a space at all to have discussions about objectivity before I was transitioning and while I was transitioning. It wouldn't have gotten through to me at all. So I feel like when people are trying to help other people who are in a difficult mental space, it is best to step into their world and give them patience and do things procedurally, not all at once. Like, don't just dump a load of information onto someone who can't really process it.
When you have to introduce somebody to a topic that might be confronting, in order for the helping to be most effective, it has to be gradual, and you have to give the person space to develop all the underlying tools to cope with it, but also all the underlying knowledge and exploration that helps them understand it in context. Which is why I have something of a problem with the idea of producing a 60-second video on which somebody tries to debunk gender theory or tries to prove gender theory, because in reality, the less time you have to express something, the more abrupt it's going to be, and the less contextual information you have to exclude, which means you're more likely to polarize people and you're less likely to actually teach anyone anything.
For me, like, long form media will always be the preference, because you need to get all of the context and the information, especially on like such serious topics. To shorten it into such a short video, and that might be the first thing that someone sees of that topic, and that could be their first impression, and that could set their expectations or like their prejudices towards that certain issue just by seeing this one short video. Like, I don't think it's a good medium for really delving into more complicated topics. When you do want to introduce certain aspects of objectivity, I guess. It doesn't have to be blunt. You know, you can have a personable way about you, which makes people more willing to listen to you and listen to your explanations. And I know we talked about that objectivity doesn't have to be free from compassion. And I really want to emphasize that, because no matter what you might be trying to pull someone out of, it's never going to help. Giving them a little bit of something blunt, or even with the short form media, like just giving someone like a really quick, shallow explanation of something, I feel like it can guide people in the complete wrong direction. And also sometimes that's how people do develop hate in the first place as well, because something doesn't get explained to them properly or in a way that, you know, is compassionate. So people get contemptful.
Absolutely, that's one of the best phrasings that I've heard thus far. Objectivity doesn't have to be free from compassion. People lose the point of objectivity when they become very strongly attached to teaching it in a certain way. People will often say that them being harsh on people is a move that's done in their best interest, because if I'm not harsh on people, exactly, tough love. If I'm not harsh on people, they'll never learn to cope with objective reality. You can't control what the world does, but you can choose yourself to be kind to people. And you can also choose to teach people about resilience in a way that doesn't compromise on your kindness. So you can show people that the world can be a dangerous place and a rather harsh place, but teach them that it's never worthwhile becoming dangerous and harsh yourself. The adaptive way is to try to become resilient whilst also not letting that make you harsh with people and force and pushing you to practice tough love.
It's a very delicate balance as well, because to be fair, like as a parent, some parents will struggle to really instill that sort of resilience on their children, because maybe they had a rough upbringing, or they were, you know, taught to bottle everything up, and just it is the easier option for people to just shut off and be you know, not let people in, or become that sort of harsh, adapt a sort of harsh exterior. But although it is more difficult, it is, I feel like, the more fulfilling option to retain your compassion and your kindness, because you get so much more out of life. And also like it affects your mood as well. Like being constantly closed off, being angry all the time really narrows your worldview, and is not good for your mental health. It's not good for your heart. Like there's a certain point where you can set boundaries with people while still not setting a boundary between yourself and the whole world. You know what I mean? Like it's a hard thing to compartmentalize, but I do believe it's important to like choose to be kind, or choose to retain your compassion to the world as a whole, without, you know, like being a pushover, or, you know, not being able to say no to people. There's a difference between letting yourself be taken advantage of, and it just happening to you because you don't know any better.
Exactly, and therein lies the delicate balance, perhaps, that how one can learn to not allow themselves to be taken advantage of, whilst not losing their sense of compassion.
It can be a thing of validation as well. Someone can be giving you something positive, but overall it's a really bad thing for you. But because you want the positives out of it, it's hard to cut off. I guess, like, I don't want to generalize, but a lot of what I see in how the world works now is that people want to feel good, they want to chase pleasure, but they don't consider like how that could be bad in the long term. Like what you're getting now that is giving you so much pleasure might not be fulfilling in the long run. And that's the thing with not being able to set boundaries. Like eventually the thing that gives you so much happiness is not going to be as effective, because you don't fulfill a deeper need, whether it be like a deeper spiritual need, or, you know, whatever.
I understand that one of the main topics we also discuss is the idea that some theories of gender that advocate a fluid approach to gender might have some contradictions in them. To give our audience some context, Would you be able to describe the internal experience of being one sex but feeling as though you're the opposite gender?
Well, for me, it sort of started when I was around 11 or 11 or 12, but when I was really young, a kid, I didn't have any notions of gender at all. Like, I was just a girl. I didn't know trans people were a thing or anything, and I was very feminine. I wore skirts and dresses and everything. But then, sort of when I hit puberty, I wasn't ready for it, and I was not ready mentally for the changes that were happening to me physically. So, because I had started acting in a more sort of boyish manner, I started to become a little bit like disgusted with like feminine aspects of myself, and I didn't want people looking at me and seeing a female because I didn't feel ready to be in that role. I guess a lot of it is that women sort of as a whole for me as I was growing up were very idealized, I guess. Like, I thought, women had to be pretty, they had to wear makeup, wear heels or whatever. Like, I didn't want that. So when I was young, I sort of strayed away from that label internally, and then as I was internalizing it, I started acting in a more boyish manner. I preferred my dad over my mom, and I spoke more like him, and I started hanging out with dudes at school as opposed to groups of girls. And for me, it got to the point where, because there was the idea of not living up to, like, I guess, the standards of what I felt like females should be, as as I was brewing, I kind of wished, that I would wake up as a dude one day. I'd wished that my chest was flatter, that, I had a deeper voice. I would start wearing the boys' uniform to school. And it did eventually get to a point where I had a complete disconnect from myself and my body. And that manifested in gender dysphoria for me. Although, when it really boils down to it, I think I did not necessarily want to be a man, I just didn't want to be a woman. So my option was, I could pass as a dude. Like, I started having feelings of idealizing men instead, and like how I could live my life as a man. It was sort of like the easier option for me, because like I didn't really know where else to go internally. So I guess with all the media I saw when I was growing up as well, I was like, oh, this is actually an option. Like, people can transition if they feel like how I feel about my body and stuff. There was definitely like a complete disconnect from myself as a person and my physical body, to the point where like I wanted to completely like shift my place in the world. But if a girl is, a bit more masculine, she likes having her hair short, and maybe she likes being a mechanic or getting her hands dirty, she could be a tomboy, and she could just be a bit more of a masculine woman. Like, she doesn't necessarily have to change into a man. And my thing also was that no matter how far I got into my transition, I would never be comfortable calling myself male or a man, because I always had, this feeling that it would be not accurate. I guess that complete disconnect manifested in a way that eventually became gender dysphoria. But it didn't start that way, really, for me. It just sort of developed.
I'm wondering about the feeling of being disgusted with one's own feminine characteristics. And I'm
Yeah.
wondering that the time at which you started to feel that way, did you see those characteristics as feminine because you saw them in other females and you decided, well, if other females are doing this, that must be what feminine is, and then you saw it in yourself and decided you didn't like it? Or was there something else that said to you, this is femininity and I don't like it?
I guess it was mostly just reliant on like perception of like other women, but also I guess anatomy wise too. Like, I didn't want people looking at me and seeing parts that were associated with being female, because I also had like a large disconnect with other girls my age. I couldn't really get along with them. I didn't really have anything in common with them because when I was in grade 6, I had a female friendship group, but as soon as it started, puberty started getting a bit further along, I noticed I had less and less in common with what girls, would talk about or like have interests in. Like I wasn't that into makeup or like, gossiping or like, boys, like they would talk about boys and stuff, and I was like, they're my friends, like I just felt it really hard to connect with women. So I know a lot of teenage boys, find it hard to talk to women or girls their age as well, because you're at that age. But that's how I felt, that's how I felt as a woman. I felt how that awkwardness talking to girls, and like I felt like I don't feel like I connect with you, you know what I mean? Like I struggle to find things in common with them. And I do have 2 younger sisters, but it's different with them because my sister Domi is more on the sort of, she's not really a tomboy, but she's definitely more masculine presenting, I would say. But like my sisters were never really into makeup that much either. We would like roughhouse, like whatever. Like we grew up very differently than a lot of other girls my age, and I felt it was hard to connect with them. So some part of me started to like resent women as well at some point, because I couldn't stand the way that they talked, and like how some of them were so two-faced, and like they would act so nice to you and then talk badly about you behind your back and stuff. And it's like I preferred the straightforwardness of male friendships. And so, because I think it might be related to BPD a little bit as well, people perceiving me was what like made me a lot. It made my identity. So how I was perceiving how men were interacting with one another, I was like, I want to be more like that. You know what I mean? And I did get a provisional diagnosis of BPD as well. The identity thing for me, whether it's BPD or autism, I'm not quite sure, but there's some overlapping symptoms. It's always been a very complicated thing for me, and my observations of the world very much turn like internalize. And when I was younger, I didn't really have that many boundaries between me and the rest of the world. So I sort of took on those observations as like my identity. You know what I mean? Yeah. I feel like the link between like autism and gender diversity and stuff is one we should probably look into more, because it's so much more complicated than just not feeling like you align with your biological sex. It's like so many societal things as well, and like how you perceive life. And yeah,
I've actually also spoken to some other individuals who identify as transgender, and one of the fears that they had in transitioning from one gender to the other was being compared to particular transgender activists. They were worried that people would start to see them as loud, brash, and in their words, people who were making a big deal of nothing, or who were looking for trouble, looking for an argument.
yes.
But then just because a few transgender people do that, A, it doesn't necessarily mean that it's inherent in being transgender, and B, it doesn't necessarily even mean that the majority of transgender people are like that. The only reason that people see certain groups as being like that is that a few people from those groups decide to behave that way.
Yep.
But then because of how they're presented in the media, people start assuming that every person is that way in that group,
Yes.
without considering that a person of any group membership, regardless of what it may be, can have a range of different behaviors, can choose different behaviors, and it doesn't mean that being a part of that group is what caused you to be that way. It could just be choices. It could be your underlying feelings about the world. It could be mental illness. It could be a variety of things that cause us to behave the way we do.
I think that, the general population probably struggle to connect to people on just an individual basis, rather than, because the news pushes a certain message, and then, everyone who watches the news, if they like that news station, they're going to have a certain opinion on that group of people. And I know some news, I don't know who it is, one of the Australian news channels, they always do stuff about like trans people, and they will always put up some video of like someone screaming or whatever, like at a shopping center. And it's like, it's common sense that people in groups are going to have outliers that, you know, make the rest of the group look bad. But it's especially bad for things, you know, people who are transgender, because it's already such a confusing thing for people to grasp. So as soon as there's one thing you can grab onto say like, oh look, like they're acting like this, you know, it's easier for people who are prejudiced to grab onto that. And you know, instead of understanding the concept or just understanding that person, an individual person, they'll grab onto those examples, you know, that jump in the forefront of their mind. But when I was trans, I did not associate with the community at all. I didn't, you know, for similar reasons, because I didn't want to be viewed as one of those people, one of the outliers who are very, you know, made the rest of the group look bad. But like, I didn't want to be part of any group. I didn't want to be part of any community. Like, I was just myself, you know. I was just trying to express myself. So I definitely understand how people wouldn't want to associate with the community, as it were, because there's a lot of issues with it. And the same could be said about like Christian people as well, because I consider myself, you know, like a follower of Christ now, but I do not associate with modern Christendom because of the inconsistencies in that. Every group has people who act badly. That's just human nature. I feel for those people because they're obviously quite mentally ill. But yeah, I can understand not wanting to associate because of those outbursts.
People in the queer community, there might be some aspect of mental illness that influences, but there could also be a lot of frustration, which is quite understandable. Some people are used to communities in which homophobia is quite common. Their activism may be a sign of frustration, that they're tired of how they've been treated.
People have differences, but they're ultimately like their own person.
When a person feels as though they are of one sex but the opposite gender, there's a potential for that idea to reinforce certain gender stereotypes by simply reinforcing the idea that the characteristics and the gender with which they're associated are inextricably linked. That is to say that being of that gender causes you to have those characteristics, and hence, if you have those characteristics, then you must be of that gender inextricably.
It's very much, when you're transitioning into the opposite. Well, you're transitioning into the opposite gender, right? So when you're doing that, you're kind of reinforcing that those aspects of yourself do belong to that gender. Like when I was transitioning, I speak a little bit more in a boyish manner, I think, and you know, I'm not that into, you know, wearing makeup or something. You know, I played basketball like throughout school, and you know, that's not just a male thing. Like, women play basketball, but because of my frame of mind, I was like, oh, this has to be, the explanation has to be that I am trans and I need to transition to a dude because I'm doing these things that like are supposed to be characteristics of men, right? Like, but in doing that, it's kind of limiting people's perspectives of men and women in the first place, because like you can have feminine men, you can have masculine women. There's really no limit on how you can present yourself while still retaining your sex. Like, you can still be a man or a woman and present yourself in a completely opposite way than how society perceives, you know, men and women as a whole. Like, even the signs on the toilets, you know, like the girl one is pink and the boys one is blue. That's still a thing in some places, and it's like, it's 2024. Like,
Exactly.
it's so little things like that put boundaries between people, and women have a more feminine aspect to them, and men might have a more masculine aspect to them. But the masculinity and femininity in itself is a fluid thing within men and women. And yeah, I think, by saying, oh, this belongs to men or this belongs to women, especially in the act of transitioning, you're sort of going backwards in, acceptance or whatever, because you're reinforcing that those must belong to one or the other. I know it's a lot more complicated than that when you have gender dysphoria, but if you're transitioning for the sole purpose of oh, I'm acting like this, so I must be the other, I think, yeah, it does go a little bit, it does contradict itself a bit.
Seeing as you yourself and possibly other people who have had similar experiences only knew that what you saw within yourself coming up naturally was feminine because you saw other women and you were taught that that was what was called feminine, and you learned to recognize that and you learned to dislike it, or you just naturally weren't attracted to it. How can we separate what is within someone versus what they've actually learned? Because if somebody has to learn what it means to be feminine and masculine, how can I truly know I was naturally, by nature standards, actually the opposite gender? I was born the wrong gender, without and separate that from what I've actually learned from seeing other people. How do you know that you're the opposite gender when you may have actually just learned to dislike your inherent characteristics?
Well, that's a good point. I guess what I would say regarding that is that where we only exist as how people perceive us. So, with the knowing what we are, in sort of the framework that everyone else uses to communicate, is sort of something that is learnt through, but I feel like what it comes down to, if you feel the need to transition, do you have a fundamental discomfort with your anatomy that makes you that sex? So, well, I transitioned and I never wanted bottom surgery, which was the first big red flag that I should have, paid more attention to. I did not want to change my reproductive system at all with surgery. So that should have been, my major indicator that maybe I was just a bit of a tomboy or a more masculine woman in some ways. My thing is, I don't advocate for necessarily medical transition, I would say, but what I would say that if you get to a point where you feel like you need to transition, one of the major indicators would be, okay, I'm not happy with what anatomically makes me this sex, right? Because that is the only objective indicator you can have of, I suppose, what makes you that sex, because everything else is just perception. Literally everything. The way we describe ourselves are just ways in which we can articulate something that's commonly understood among every other person, right? It's not something that we can really attribute to biology, something that can be intuitive. I guess femininity and masculinity are a little bit more complex because they can be intuitive in some aspects, but in the sort of societal scope of how you're perceived by other people, it's very hard to pinpoint, what are actually examples of what something's feminine or masculine. So I would say someone who's transitioning would probably be medically transitioning because they feel that fundamental discomfort with their biology, at its most basal level. But yeah, I don't that being said, adults can make their own decisions and everything. But I do think that if you're going to be doing that, you know, really boil it down to a complete physical discomfort with your biology, like, yeah, because I feel like, you know, there's so many ways feminine and masculine traits can be described by other people. It's just so hard to like pinpoint it objectively, you know what I mean? Like, it's just, yeah, it's hard to be an indicator for such a serious decision.
So what's an innate and what's objective and what's subjective and what's only describable by our own standards? It really is quite, it can be difficult. That can be difficult to
Yes.
separate, because even though
Yes.
phenomena exist, it's really the only reason we understand them and the only reason we can describe them is because we devise language to speak about them in detail. And often language is how we think, and the way we
Yeah.
use a language influences a lot about how we perceive something. So it can be difficult to pull apart, but it seems the common theme and the most important theme is how one feels comfortable in their body. Is it possible that a man who essentially has so much in common with a woman that he feels as though he must be a woman is not so much a woman, but a man with feminine characteristics?
We perceive those women to be having those characteristics, and we, you know, categorize them as feminine. So if that the man in the hypothetical was having all of these characteristics, we might call him feminine in that context. But you know, he can still be a man because he's biologically, you know, male, but because of how femininity is perceived, you know, by like subjectively, we might categorize him as a feminine man in that context because the women are exhibiting the same characteristics. It used to be that when you saw someone who was one like a man or a woman but acted more like the other like gender or sex, you'd just be like, oh, okay, like they're a bit more of a tomboy or a tomgirl. And I feel like it used to be less complicated, you know. But now, because there are so many like labels and stuff, like it's hard to just exist as yourself. And yeah, I do think that like focusing on the differences too much separates us, you know, like we don't need to focus so much on the differences necessarily between men and women, and more so just like actually just being like a human being, and you know, acknowledging that because of how we are built, we may have certain strengths or weaknesses in certain areas, but at the end of the day, like we can connect as human beings as well, like, and we can adopt certain traits that might be more feminine or masculine perceived by everyone else, you know.
The idea that certain characteristics are inherently masculine and feminine and have to be, or that people should abide those characteristics if they are of those particular genders,
Yeah.
that in itself is sexist. But then the idea that if a person sees themselves as being the opposite gender simply because they feel they have the characteristics of the opposite gender, it's possible that they've also been taught sexist beliefs. Like they've been taught, well, you must be the opposite gender because you have those characteristics.
Yeah.
And ultimately, it's possible that if we're able to teach someone to limit themselves by being gender conformist, it's also possible that you can teach someone to be gender non-conforming, but still in their own way, boxing themselves into a trend that could potentially limit how much they do for themselves as a person or what they can do just based on their individuality, regardless of gender existing.
Yeah, for sure. Like it could go both ways, like whether you're being raised to like box things in sort of like more sexist boxes, or you get raised in a non-binary thing. That's still like, you know, there's still boxes on both sides. I think certain things suit men more and certain things suit women more, but that's something you can see. Like that's something you can pick up on. It's like, you know, sometimes, you know, if a guy wears a dress, you'll be like, oh yeah, like he can do what he wants, but also that design of clothing might be more flattering on a woman, but that's just because of our bodies, like how our bodies are made. Like that's not even necessarily like it doesn't have to be a gender thing, you know what I mean? Like the dudes used to wear robes and stuff, like long robes and like kilts and stuff, and it's like those were made for men, like, but to suit their body. It's not the style of clothing that was like, people stuff is like tailor made for a person. It's not just things are not just limited to men or women. Like it's like something either suits a person, or that could be traits, that could be clothing, that could be how you present yourself, how you speak, suit a person, like an individual. Yeah, I like is a lot. You can take some of the complication away by just visually taking things in and being like, I don't know, like people are the way they are, and things get really complicated when we have all these boxes, and it could be just as bad on either side. It could be as bad on a more conservative side or a more free sort of like freedom of expression sort of side, but just being raised non-binary or something. Like there's just boxes everywhere. Like it doesn't matter what side you're on.
And look, humans, I think, probably have an evolutionary predisposition to thinking categorically because it helps them make sense of the world. But at the same time, as we can see, it becomes problematic. And as you've said, from different perspectives, if somebody posits that, for example, because I'm a man, it's my responsibility to the world to be domineering, to be hard, and maybe to dominate this conversation, seeing as I'm the one who is naturally meant to be in charge, then you can see that that's a problem, because then it doesn't allow me to be productive. It's limiting. But let's say that there was another perspective. There could be another perspective, perhaps a very polarized opposite perspective, that says that it's my duty as a man to oppose absolutely everything that is associated with being male in order to destroy a system of oppression. Now, there are some things about me that are stereotypically male. There are some things about me that are not stereotypically male. What each individual has to do is make a decision about what fits in with them, what's right for them, and what allows them to best get on with people, and also what's right by them. Because in the end, if, for example, if a woman is agreeable, that is a stereotypically feminine characteristic. Like agreeability is a very feminine characteristic. But if she or a man, regardless of the gender, is too agreeable, then they leave themselves open to being exploited. And people do deliberately take advantage of agreeable people. So there are some things that are no good for any person, because any person can get harmed from them or cause destruction with them. But if a person just has the right amount of agreeability that gives them an advantage in certain activities, like, for example, in certain jobs or certain pursuits, then they can decide for themselves how to best use that, as long as it's not destructive and it doesn't cause them any harm. So either perspective, be it I must oppose this inherent characteristic, which, again, as you've said, there's credence to the idea that sometimes men and women are naturally born with different characteristics because Mother Nature wants us to work together in certain ways. And if those are your natural characteristics, then that's fine, as long as you are aware of them and you choose to follow them, and you're not simply doing that because somebody else is telling you to, because that's when authority starts to take over, and that's when it's not a good level of authority.
I feel like we need guidance as beings, and sometimes the channel for which we are given guidance is not that great. Like the government, for example, might not be that great in certain areas, but we have that inherent need for guidance. And I can get my guidance, from reading the Bible or attending meetings, praying, but other people can get their guidance from political areas, and that's the difference. Like wherever we get our guidance from, we all have that common need of, like, we need to be we need to have something like guiding us, there's that need. It's easier to put things in categories because it helps us make sense of the world, but you can be free of those. You can really critically think about if they're doing you any good or if they're just, limiting. And I know a lot of women who are very headstrong, they're very self-reliant, and these might be considered more masculine traits, but they're like, they're you can see that they're women, you know what I mean? And I know some men who are a little bit more like vulnerable or a little bit more into their creative side, or like it's totally dependent on just the person. And yeah, it definitely limits having a productive conversation if you were to say just like you have to act a certain way because you're this or whatever. Like,
Ari, another critical idea that you raised was the issue of the medical industry and how the medical industry addresses issues related to gender identity, gender dysphoria, and related mental health subjects. What's your experience with this, and what are some of your observations?
my experience was very streamlined when I wanted to get on HRT. I had one appointment with a doctor, an initial appointment, and then my second appointment, she prescribed me HRT that appointment. So I wasn't required to actually undergo any therapy or any official like diagnosis process before I was given testosterone. So she asked me a few questions about myself, but it was like probably a 5-minute process, the questioning process, and then she gave me some, like a sheet on the effects of testosterone or the effects that they knew of, because of course there were some that are not that well documented yet. Second appointment, they gave me my prescription, and I feel as though it was too easy. And when I did have a short amount of counselling, that was government provided, but this was a long time before I started HRT. And I had some concerns about autism. I wanted to see about getting a diagnosis. But they told me, like an autism study is about $2,000. At your age, it's going to be a little bit hard to do it through therapy because I didn't get it when I was younger. But when I brought up that I had some feelings of dysphoria, sort of without clarifying or anything, they just immediately started calling me he. I could have been non-binary or anything, and they just immediately started calling me he, and they actually changed my documentation so that when they were referring to me in reports, they wrote he in all of the notes and everything. And I feel like that was very quick. Like it was very like that was their guidelines that they were given. You know what I mean? And that whole process sort of leads me to believe that there's maybe needs to be more to really make sure that people are making the right decisions for their bodies and their minds long term, because I definitely feel like if I had have gotten some sort of other, like therapy or anything, I might not have even transitioned. But therapy that is unbiased is the main thing, because I don't know if this is true, but I have heard that they're starting to make it so you can't say certain things in therapy now, and you can't ask certain questions. And those questions were the questions I needed to be asked to really make me critically think about what I was doing, And I know before I said that it's hard to confront people with objectivity when they're in that sort of headspace. But when it comes to medical transition, I feel like it's such a serious undertaking that someone should be mentally getting to their point where they can have those objective reality conversations before they would do something like transitioning, you know what I mean? And I just wonder whether there are some sort of motivations, whether it be monetary or whatever. I just wanted to really highlight that there's not that much information about people who detransition that's like publicly accessible, or whether the studies haven't been done or they're being, hidden. I feel like scientists and like psychologists and medical practitioners shouldn't be afraid to share their studies regarding detransition or even just transition, in fear that they're going to be shunned by their communities because of this sort of wave of like, I guess, like pro trans or pro transitioning, as opposed to like hearing both sides and hearing the facts. Yeah, I just really wanted to like highlight that there shouldn't be a fear for people to bring out information that might make people question whether them transitioning would be the best move for them, because that's a healthy question to ask for such a serious commitment, right? Like,
It's hard to attribute the quality of intentions to someone.
yeah,
I would say there's a number of major possibilities. One of the major possibilities relates to feeling the need to validate other people in order not to make them feel invalidated and potentially worsen their already strained feelings. It's possible that the industry, the community, the scientific community might believe that by validating without question people's feelings, what they're doing is what's in their best interests. Now, being compassionate is definitely in people's best interests. It's also in society's best interests.
yeah,
But as we said, one can be compassionate and still explore alternative explanations for what someone's experiencing. And
yes,
I'll testify that the one of the roles of a good helper, whether they be a psychologist or a counselor or a coach, is to help people explore lots of different possibilities to explain what they may be experiencing. It's possible that nobody has bad intentions. No one is deliberately trying to extract as much money from people with gender dysphoria as possible. There are theories that there's more money in addressing the symptoms than there is addressing the issue at heart. That's a
yeah,
theory that unfortunately is hard to substantiate, but it's certainly a theory that's been posited.
yeah,
But it's also possible that this is completely based on good intentions, that we want to help our fellow human by sparing their feelings. And again, we can be compassionate, but still also help people do what's in their best interest, which is to question everything. And that can really be for any person. I know that a person who's experiencing gender dysphoria, as is a person who's experiencing any mental illness, is quite vulnerable, and you have to manage that with tact, and you have to make sure that what you do as a helper doesn't cause psychological harm to that person. And there's a lot of responsibility in that. But it is certainly possible to be supportive, but also objective and persistently objective with someone at the same time.
yeah,
And I think that's part of the responsibility of a good helper. And I think you also need to be able to demonstrate. If you're going to be a helper, you have to be able to demonstrate to someone that anything I do for you is not for the purpose of judging. It's for the purpose of helping you get the best from life so that you avoid traps and can live the best life you can with as few problems as possible into the future.
Yeah.
Ultimately, what you should be doing is lessening people's reliance on you as a helper.
I also think that what you said about intentions, it could very well just be that they're just doing what they've been taught. Like they have a rubric or whatever. They have certain guidelines, and they're just enacting those as a practitioner. I guess more so my issue was sort of with the guidelines themselves, like not the people necessarily enforcing those. But I'm sure you've probably heard this loads of times that the pharmaceutical industry makes people reliant and could be a cash grab. But everything's like, it's hard to prove anything, because if things were hidden, they're hidden. We can't get them. So there's just, it does go down a hole. But I guess the only thing that made me sort of think of it in a more negative light was when I did come back to my doctor and try to like get off testosterone, that process was way slower than getting on it. So when I told them that I wanted to detransition and I started thinking about getting off T, it took me way longer to get an appointment than starting, and my doctor actually had gone away, so I had to see a different doctor. But when I was at the appointment, when I expressed that I wanted to stop testosterone and that I was going, back to aligning with my biological sex, sort of it was like a question of whether I was sure or not, or whether, they put me down as they, them instead of she, her, even though I clearly stated I wanted to detransition. I feel like there was a lot of pushback on me wanting to make that decision as opposed to continuing. And when I actually asked like how to go about coming off testosterone, the nurse actually didn't know. She had to Google it during the appointment, and she actually went on Reddit to see like
The nurse.
Yeah, she went on Reddit to see how to wean off testosterone. And I came to her saying maybe I just lower the dose by like 1 pump every week until I'm at 0. And she like literally, she was on Reddit and she's like, sorry, I don't really know that much about this. So she like Googled it and she's like, yeah, that sounds fine. I'm just going to email your doctor and say this is what you're doing. So for me, it was really scary. I was like, okay, they know so much about going on it, but when it comes to coming off it, they don't know. Like they have to Google it in the appointment. And that was like, for me, that was sort of like a bit of a wake up call because I like to trust people. I like to have trust in people having good intentions as a whole, but I also am very skeptical about certain things because of like what I've experienced and what I've learned. I just like that was crazy to me. I was like, you don't know, like I booked a doctor appointment, so, and it was a gender clinic as well. Like it was actual gender clinic.
Oh my word!
And they didn't
really?
know. They just didn't know what to do. So that was sort of a bit scary for me. I was like, oh well, what about other people like me who want to detransition? What if they get too scared to do it because their own doctor doesn't know what to tell them? Like, you know what I mean? It just made me sort of question some intentions, but she was just doing her job, I guess, but also like she was a nurse at a gender clinic, so I was a little bit surprised that she did not know what to do. But yeah.
Understandably, it would be quite scary. And look,
yeah,
from that experience, I can understand you could try to extract an explanation as to why it is that they were very quick to give you testosterone, but very hesitant to move you away from the transition therapy. As you said, it's difficult to demonstrate that this is what happens in every case, but it certainly meant something for you, because I imagine that it puts you in a difficult position of having to essentially prove yourself to say, well, yes, I am competent to make my own decisions.
During that time, I was a very, very passive as a person. So for me to even book the appointment was really difficult. And I thought that even if I wanted to detransition, it would just be too hard. I didn't know how to go about it. So the amount of sort of resistance that I was met with, like even just in her facial expressions and stuff, she's like, are you sure? Like, I'm just going to put you down as they, them. It was hard because I already was so passive. Like I struggled to really assert myself. I have met a lot of trans people who say, even if I wanted to detransition, like it's too late. I've already done so much stuff. And for me, it was like I didn't even get any surgeries. Like I was just on testosterone. And the only the lasting effect it has on me now is just like my voice is in the upper end of the male range now. So when people first hear my voice, they're gonna assume I'm a dude. Which isn't, it's not that bad. It could be worse. But for other people who have already had surgeries and they're detransitioning with, these surgeries done, it's like scary to me. Like I'm really grateful that I was able to get out at the time I did, but also people are scared to detransition if they want to, because there's not that much support for people who are detransitioning like readily available, I guess. And I have been talking to some other detransitioners. It kind of leaves you lost. Like I felt a bit like that when I was detransitioning, because I was like, who do I ask? Like, where do I go for people who know about this, you know? Like, I just, like, if even my own doctor didn't really know, like, who was I going to go to, you know what I mean?
It seems commonsensical that if you support one group of people, you would also support the other. And
Yeah,
if you're only supporting one group of people and you're not supporting the other, when it's so obvious that you should support both, it kind of makes it's easy to conclude, well, there must be a reason for that. Is it
yeah.
ignorance? Is it negligence? Or is it that there's something else happening?
I have to watch that with myself too, because I could be drawing connections between things that aren't connected, and I could be missing connections as well. But yeah, I just feel like, yeah, if there's going to be, if you're going to put someone into a process like HRT, it should be well researched on both ends of it, like the start of it and the finish of it. And if someone wants to reverse it as well, like when people go on medications, when they want to come off the medication, like doctors have that procedure to help them come off it.
Understandable, and I agree with you. It would do people well to be able to rely upon attending their doctor or their other health professional and know that
Yeah,
whether they want to transition or detransition, that they're going to get the same quality of care and they're going to be able to
yeah,
access information if they need it.
yeah. And people also need to be like fully aware that it's not fully reversible, because a lot of people who transition believe that everything can be reversed just as it was done. But when you're like, for example, when your vocal cords thicken from being on testosterone, when you come off it, they don't thin, they don't go back, because it's like a growth, like it's something that develops. So like, it's not reversible, you know. Like, I can't just hop on some estrogen pills and make my voice go back to normal, because it's the testosterone, which is the active hormone, that actually needs to leave your system before you start having normal female like hormone levels again. And I have been like trying to eat more foods and stuff that are higher in estrogen, which I think has been helping a little bit. But they weren't like doing that at the start of your detransition is not going to reverse anything. Like, if I wanted to make my voice go higher, I would have to do voice training now. Like, it doesn't, you know, it doesn't go back to how it was before. They do say on the thing that some things are reversible and some things could be permanent, like balding, or, you know, like certain like the voice and stuff. And, you know, personally, I'm actually fine with having a deeper voice. Like, it's just more of when I'm perceived by other people is where it's the issue again, because it's like now I'm having reverse like dysphoria, where before I was having dysphoria of being a woman, and now I'm having dysphoria because people will perceive me as a dude if they hear me talk for the first time, or, you know, even someone on the street like will be talking to me, and then I start talking, and they're taken aback because the voice coming out of my mouth does not sound like a female voice to them. And that's,
Sure.
yeah, that's again more dysphoria, you know. Like, on the other end, I had a friend who transitioned, and they thought that everything was going to be reversible. We're not friends anymore because after my detransition video came out, they blocked me. I wish the best for them, but from their eyes, I was betraying the trans community.
I understand that you also have some concerns about whether the scientific community in general possibly should reconsider its position on publishing a broader range of research findings, such
Yeah.
as the experiences of people such as yourself. What are your thoughts on the scientific community? What messages would you like them to get?
Consider doing some things independent, because I know that some corporations now will not let you publish things in certain topics, such as, you know, something that might be results that would paint transition in a negative light. I would say, if you're truly passionate about uncovering truth, your peers are going to be really instrumental to either making or breaking your studies, because you need a lot of people in the scientific field, like, to actually get a study done. I would say that, firstly, consider where you are, and also I don't even know if studies are being done. Like I said before, that they could be hidden, but I don't know that they're actually being done in the first place, because you need someone to fund them. You need people who are going to be on your team. You need detransitioners as well to partake in the studies. And I'm like all for, like, I would be a lab rat. I don't care, but it's like I don't know whether things are being hidden or whether they're actually not, like, being started in the first place. But not even just detransition, like actual transition, like do more studies on people who are transitioning and medical transition, and also the negative sides of how it affects them, not just like the positives. Especially with things like puberty blockers. Like, I do not advocate for children transitioning. I believe that it's very, it can be pretty dangerous for anyone under 18, even, 18 or over. But do the critical research, because detransitioners are coming out now wishing that this research had been done in the first place. But I understand it can be very difficult for people to get started in the first place, because either they're not being supported, or they're too scared about how people are going to receive the data. But even like the way you present the data, it speaks for itself. Like, it's not you're not the numbers, you know what I mean? You can put disclaimers on certain studies and stuff and say, this is what it contains. Well, that's what they have anyway, at the start before you read a study. It's just an area that I think needs more looking into in general.
And perhaps what could encourage more discussion in the scientific community is gestures as simple as what we're doing now, being willing to discuss different perspectives, involve everybody in the conversation, regardless of whether they agree with our particular perspectives or not, and just destigmatize the discussion of perspectives, because in the end, one can take it upon themselves to have civilized discussions without an agenda, without intending to push society or a particular event in a particular direction, but just for the sake of exploring ideas. I also understand that you've made a lot of observations about the link between neurodiversity and autism, and the autism spectrum, and gender diversity. What have been your observations on that?
I have noticed that even when I was doing that short-term counseling, she did say to me, like, oh, many people who are on the autism spectrum are also gender diverse. And that sort of was like, for me, it's like, okay, then let's draw the connection and figure out why that is. Because a lot of people like me who maybe have had trouble with their identity most of their lives, even not in the context of gender or femininity or masculinity, even just personality as a whole, it can be roped into so many different areas. But I feel like it's a difficulty processing information the same way as everyone else. So that can manifest in so many different ways. Like, I'd always struggled more in the hands-on aspect of things, like understanding how things sort of interact with each other the same way as other people. And I struggle with emotional, like, tone and like articulating myself properly. And that all sort of, like, for someone who's on the spectrum, I think you should be help with that. If I had been getting help with my issues with processing information and emotions and stuff, I might not have ended up developing such severe gender dysphoria, because I was able to have a more solid sense of identity. But because I completely did not get that addressed at all, like I didn't get any help for anything related to like autism, like symptoms. It just went directly to gender dysphoria. I feel like the logical step would be first go back to the root problem, right? Like, to go back to the first thing, which is like unstable identity. And I think that a lot of people who are on the spectrum are gender diverse now. You do see it a lot online. People will have, their pronouns or whatever, and then next to it they'll say autistic or on the spectrum. That link should be explored a little more, because autistic people who end up detransitioning might have avoided transitioning if they had help with, their identity issues in the first place. But yeah, I feel like it's an identity thing that then can manifest in areas such as like gender, and a lot of people who transition felt that way from a young age, whereas for me, I was just a normal, like, when I grew up, I was like what you would classify like a normal, like, little girl. Like, I didn't have any issues there. It was more when I got into puberty, because of that emotional processing issue, the identity issues and all of that, it then manifested into gender dysphoria. So I feel like if that had been explored a little bit more or addressed, I could have avoided the transition part. When I saw the doctors and the counselors, like, the way they were phrasing it was like, well, maybe the issues are all part of the gender dysphoria. But the way that I was explaining it and the way that it happened for me is that the gender dysphoria was the conclusion, not the beginning. It was what developed after the accumulation of all these other issues. Like, I had a provisional diagnosis for major depressive disorder as well, and like general anxiety and like, BPD symptoms. Like, there were so many things before I sought HRT, but I guess, like, that's retrospect. When I was actually in the appointments, I could have been trying to convince them that it was all gender dysphoria, so it would have been easier for me, because I didn't want to confront anything. But yeah, I guess that it can be hard to really penetrate that if, someone's coming to you thinking that it's all related to that, like gender dysphoria. But, for people with gender dysphoria who are not autistic, I can imagine it might be more like in a more acute feeling of the gender part of it, rather than the identity as a whole, like, issue. You get misdiagnoses and things happening all the time, where people have to see like maybe 6 different people before they get to the actual root, or they finally understand what's happening with them. It's hard to not want to just take what you're being told for the face value, and needing to see multiple people, because I did not see multiple people. Like, I saw a few people, but my experiences were not great. The first thing I did was at school, when I had like a telehealth appointment with a psychiatrist. It was a really negative experience. Like, she came on like 15 minutes late, and she looked really bored when she was hearing me talk. And like, at the end, she basically she told me to go on antidepressants, and she told me, that I had BPD, anxiety, and depression. And she told me to see my doctor about antidepressants. And then I was like asking a question at the end, and she like ended the call like while I was asking a question, and I like cried so much after that. I wasn't I wasn't motivated to pursue any other help because of that experience. And I feel like a lot of people, like, if they get that negative experience and they're already, suffering mentally, they're going to be less likely to try and actually get help, like, get a conclusion. But, I did end up going to those other counselors, and while it was very, like, validating, they also did give me, like, this diagram for, like, states of emotional arousal. So, like, when you hit, mania, and then when you were in the highs and lows. And that graph that they gave me was the first time where I was like, oh, that actually makes sense to me, because I learned better through theoretical things. That graph was really helpful for me, and I feel like, if I had more stuff like that, that would have been more helpful.
Despite these measures that we take, in trying to be tolerant of each other. Unfortunately, sometimes discrimination does happen, and to deny it would be to completely ignore the reality that people, as long as people exist, there's going to be prejudice, and there's going to be people who suffer discrimination just based on how they look or what they call themselves, or some other aspect that is completely inconsequential to their humanity. There are different arguments on discrimination of people who are gender diverse. Some would say that people who are gender diverse are more likely to suffer discrimination. There are some people who are on the polar opposite, say that people aren't really discriminated against because it's illegal, which isn't an argument in its own right, because just because something's illegal, it doesn't mean it doesn't happen. What are your observations about discrimination?
There's always discrimination everywhere. Like, people who are gender diverse would experience discrimination more in areas that are less tolerant of that type of thing. It lessens over time, but it's still to the point where you can't deny that people get discriminated against.
I would argue that one of the reasons that it can be difficult to measure is that sometimes it can be difficult to find somebody's motives.
And also, it's hard to define unless it's blatant, someone's blatantly saying, you're part of this group, so I hate you, because that does happen as well.
And there's also the phenomenon of dog whistling, in which people try to indicate that their opinions are more moderate than they actually are, and they're doing that to gain favorability. So, for example, there might be people who genuinely hate trans people, but who might appear to agree with us and the conversation we're having. And perhaps some people might think that we're dog whistling by expressing opinions or perspectives that are not necessarily congruent with the current paradigm that is generally accepted when it comes to gender theory. Now, it's impossible to disprove it's impossible to prove or disprove either of those suppositions, because you can never really demonstrate objectively somebody's motives. But I will say something to that at the end of the discussion. But that's one of the difficulties.
I love humanity. Even though there's so many things to be critical of, I like talking to people. Doesn't matter what we might believe. It's good to just have conversations.
Absolutely. I couldn't have said it better myself. Something I say is, we're all soldiers in the war of life. We all face our struggles. We're all eventually going to die. We're all going to face adversity. If we hate each other, then we're going to cause ourselves and each other more adversity than is necessary. So let's try and get on as best we can, because in the end, we're not on this earth for very long. Ari, thank you so much for joining us today. Do you have a parting message for our audience?
I would say, be nice to your fellow human. Hold a door open for someone sometimes, smile at people when you walk down the street. There are things to be joyous about so much as there are things to be sad about, and it's fine. Just try to find peace within yourself and value critical thinking as well. Do not be easily led astray or easily swayed in a certain direction.
Well said, Ari, well said. To our audience, thank you for joining us today. Please remember, if you are experiencing any type of conflict or issue, whether it be with regard to your physical health, your mental health, your gender identity, otherwise, please do not take advice on the internet as gospel. Talk to someone you trust. Seek the advice of a medical practitioner. Get help. It's never too late. You are valued. Also, I'd like to extend an invitation to anyone out there who might feel a little bit at odds with the conversation. Whether you agree with us, whether you would disagree with us, I would very much love to hear from you. I value the experience of talking to different people, even if we don't necessarily come to the same conclusions. Ari and I might have different perspectives, but I've really enjoyed this session, Ari. I've learned something from this, and I'm really, really happy to now be able to carry that with me and use it in critically examining the world. So thank you for joining us, and in the meantime, take care.